Hello everyone, welcome to Excellence Biomedical Engineering. On today's video, we will be talking about the topic Regenerative Medicine Approach for Transplantation, Wound Healing, and Tissue Repair. Regenerative medicine. What is regenerative medicine? Regenerative medicine aims to restore, replace, or regenerate damaged tissues or organs damaged by disease, trauma, or congenital issues using advanced biomedical approaches. Now, let's talk about transplantation. We all know traditionally that transplantation has limitation due to donor shortage and immune rejection. Now, the solution to this problem is regenerative medicine, where it offers alternative approaches such as tissue engineering and stem cell therapy. Now, tissue engineering, we all know it involves growing organs or tissues in the lab using cell and biomaterials. Stem cell therapy uses pluripotent stem cells to generate functional cells for transplantation, reducing immune rejection risks. Wound healing. Now, wound healing, we all know that chronic wounds such as diabetic ulcers pose significant challenges for conventional treatment. Regenerative medicine provides innovative solutions for enhancing wound healing. Bioengineered skin substitutes can promote tissue regeneration and accelerate wound closure. Growth factors and gene therapies stimulate cellular proliferation, angiogenesis, and extracellular matrix production, aiding wound healing. We all know that wound healing is a gradual process that takes place naturally. In case where it is impossible, that's where regenerative medicine comes in. Now, tissue repair. Regenerative medicine holds promise for repairing damaged tissues such as cartilage and cardiac muscle. Scaffold-based approaches provide a supportive framework for tissue growth and integration. We all know that mesenchymal stem cells can differentiate into specific cell types, promoting tissue regeneration. And we also have the 3D bioprinting which enables the fabrication of complex tissue structures using patient-specific cells. Now, the biomedical application. When you talk about regenerative medicine, and then you talk about wound healing, and then you talk about tissue repair, we all know this, that the application of these are all going to be into the clinical domain. So we all know that regenerative medicine approaches have shown promising results in preclinical and clinical trials. Successful transplantation of bioengineered bladders, trachea, and blood vessels has been reported. Wound healing using regenerative medicine techniques has demonstrated accelerated and improved outcomes. Ongoing research focuses on advancing therapies for tissue repair and developing personalized treatments.